So I am a medical oncologist at the University of North Carolina with the Lineberger Comprehensive Cancer Center. And I wear two hats. I take care of patients who have cancer, but I also am a cancer researcher interested in how we can improve health systems to improve outcomes for patients. The types of research that I'm doing on a daily basis are really focused on trying to improve the ways that we deliver care, recognizing that there are a lot of factors that impact how well a patient with cancer actually does. And some of those factors are the treatments that they receive, but there's also the way that we design our health system actually determines sometimes who receives which treatment. Do they receive it on time? Do they receive it for the full duration of the recommended course? And so I'm interested in actually not so much improving the treatments that patients receive, but how they receive those treatments. So I've been doing this work for, well, about 2.5 years on faculty at UNC. I was also at UNC during my hematology and oncology fellowship, which is where I really started this research. And over the course of that time, I've had support from great mentors at UNC, but also support from the Lung Cancer Initiative. The project itself is building on work that the Lung Cancer Initiative funded during my fellowship, which helped us identify patients with advanced lung cancer who are especially high risk to return to the hospital. But what we want to do now is actually deploy that in the clinical care setting. So we recognize that having a tool to identify high-risk patients is really of no value if we don't figure out a way to embed that tool in our routine clinical care. And so that's what this funding is going to do, is help us determine how to embed it into routine clinical care and then provide additional layers of support to high-risk patients, including referral to palliative care, support from lay navigators who can help patients navigate our healthcare system, and a novel idea of collecting patient-reported outcomes, which is kind of a way of doing weekly symptom monitoring to see if we can notice signals that a patient is clinically not doing well. Maybe they're having a high symptom burden earlier so that we can actually intervene and support them before they ever have to show up in the emergency room or get admitted to the hospital. So this grant is going to fund work to study patients who have newly diagnosed advanced lung cancer. So cancers that started in the lung that have perhaps spread to another part of the body, and identifying those patients who have newly diagnosed advanced lung cancer who have been hospitalized around the time of their diagnosis. We've seen from prior work that about a third of patients with advanced lung cancer are hospitalized within 7 days of that diagnosis. And we've identified ways to predict which of those patients is at high risk for coming back to the hospital. And so this work is actually going to allow us to implement that risk stratification system, that system where we identify patients with newly diagnosed disease and identify those who are highest risk for coming back to the hospital, and then trying to put some additional supports around those patients to try to lower their downstream risk. So one of the things we hope to see is fewer patients being hospitalized. Patients and their caregivers repeatedly express a desire to avoid hospitalization. However, advanced lung cancer is often a highly symptomatic disease. Patients can have shortness of breath or cough or uncontrolled pain. And those things often drive hospitalizations that, of course, are not planned and are not desired by patients. So we hope to see a decrease in those hospital stays and emergency room visits. So investment in cancer research is hugely important to advance the field. Researchers like myself have to be accountable for our time. And so that funding enables me to protect my time to do the research that I'm interested in and have the resources that I need to actually conduct the research itself, to do the science, so to speak. Yeah, so my take on cancer research as a field in general, it's a time of great excitement. I think there is progress being made really in every domain. I have outstanding colleagues who are advancing new drugs for patients with cancer. I have colleagues who are improving recruitments to clinical trials, which are hugely important. And then folks like me who are doing work in improving our health systems. All of these things come together to improve the care for our patients. And I think it's a really exciting time to see that progress being made. To those who support the Lung Cancer Initiative, I'd like to say thank you. Thank you for your generosity and thank you for your commitment to improving outcomes for patients with lung cancer. Your investment will help us advance the field. And with my project, I hope to develop ways to reduce hospitalizations amongst patients with advanced lung cancer to improve the care for those individuals and their families.